Welcome to Wisdom for Nonprofits, bringing the best business wisdom to the nonprofit world. Proven leaders share their experience, insights, and best practices. Finally, a podcast for the busy nonprofit professional. And now, your trusted advisor, Bettina Meyer-Flug.
Navigating the social service maze. Do you struggle finding a place that indexes all the local available resources? Or maybe you need to look for a specific state or national program to support your nonprofit? If you don't know where to start, stay tuned because on this podcast, we're going to explain all the details about Aunt Bertha. Aunt Bertha created a social care network that connects people and programs, making it easy for people to find social service in their communities, for nonprofits to coordinate their efforts, and for customers to integrate social care into the work they already do. Maybe your nonprofit service are already listed there and you don't even know. Don't worry, we're going to explain how to use this amazing tool. I have here with me today Alex Turnacliffe. I met Alex in a special event called Caring and Sharing that happens every month. And I was impressed about all the features that this tool was providing, that I decided to share this information with all the nonprofits professions that I know. So welcome, Alex. Can you tell us a little bit about your background with nonprofits, why you engage yourself with this amazing world, may I say?
Yes, thank you so much for having me, Bettina. It's great to be here, and it was great connecting with you and all the other organizations at the Caring and Sharing group. So yeah, my name is Alex Turnacliffe, and I am the Community Engagement Manager with Aunt Bertha here in Colorado. So I'm actually based down in Denver and have had a background working for community-based nonprofits as well as philanthropy organizations. And I really am passionate about, on the grounds community efforts to create healthier, vibrant, more connected communities. So definitely thought that Aunt Bertha is a great tool for this and have been really excited over the last 18 months to be working with community-based organizations across the country, as well as here in Colorado where I'm based, to be able to connect the people in the neighborhoods to the programs and services. So thanks so much for the opportunity.
You're welcome, Alex. Can you tell us the story about how Aunt Bertha was created and what problem your platform came to solve?
Yeah, that's really a great question. So our mission at Aunt Bertha is to connect all people in need and the programs that serve them with dignity and ease. And all missions should really be tied to a tough challenge. And we definitely have one in terms of navigating the social service maze. In terms of finding programs, a lot of times when people are in need, it's not always obvious for them where they can go to reach out for services, even if they've been in a community for a while, unless they have someone who's working with them, maybe a dedicated case manager or social worker. It can really be tough to find how to gain access to maybe food programs or financial assistance or housing resources. There's a lot of stigma attached sometimes to reaching out for services. And we've seen on our platform, especially over the past year, the need for these resources really skyrocket with the COVID-19 pandemic. So we were created about 10 years ago, actually more than 10 years ago. We were created more than 10 years ago, starting in Austin, Texas. And our founder, Aaron Gray, really came to this idea of a social care network and platform based on personal experience. Aaron, when he was in his 20s, his mother was diagnosed with a rare brain disease. She really had some complications and needed a lot of support. In his late 20s, he became her full-time guardian and moved her from upstate New York, where he grew up, out to Austin, where he was based. And he really had some challenges. And he really had some challenges in terms of finding, longer term care and resources for his mother. He didn't always know how to access programs, fill out information, know what he or his mother were eligible for. And it was a frustrating experience. And I think that sort of helped him think maybe there can be an easier way to find, search and find and connect to programs in here in Central Texas. And that's where we actually started. Over the past 10 years, we've actually grown quite a bit to become the largest social care network across the country. So now anywhere in the US, you can search your zip code to find at least 1,200 programs and services. And we actually offer 500,000 program locations across the country. So really wanting to bring the information and access to programs no matter where you are in the US.
Wow, that's amazing, 1,200. But I remember you saying that your company started helping government programs, and now it's a huge platform where everyone can navigate and find the care they need. But can you tell us how it started actually?
Yes, that's a great question because it's not just, it did start from the personal experience of Aaron with his mother trying to navigate resources. At the same time, around the time of the Great Recession, Aaron was working for the state of Texas to help make it easier for individuals to kind of access and follow up on receiving kind of state level benefits, whether it was WIC program, SNAP, formerly food stamps. And so he has a technical background and he was working on a project to make it easier to automate sort of the status of applications. So instead of having to call in and be on a waiting phone line for an hour to see where your application is at in the process, they created some efficiencies for people to actually be able to check and look up and get the automated tracking response of where they were at in the line. And so he was working with these government programs, figuring out that there was a huge need, just like now with COVID. During the Great Recession, they saw the need for these social service programs that the state of Texas provides just skyrocket. And so they really were racing against time to try to find an easy, sustainable way for people to connect and follow up on their application. So he started and said, we've made a lot of progress with these government programs, but this is only a small slice of the pie. There are so many other great resources in the community, whether they're nonprofits, whether they're faith-based programs, or even corporate social responsibility programs from local businesses. He decided, I want a way to actually bring those into the fold and not just index and streamline access to government programs, but everything else, really open that funnel. And that's how Aunt Bertha was born. So the name Aunt Bertha, actually, the original tagline was that Aunt Bertha picks up where Uncle Sam leaves off. So the idea of beyond just government social services, bringing access and democratizing the process of accessing information to all types of programs was really the impetus to start this platform.
Yeah, and then I was curious, and I asked you this before, that your organization, it's not a nonprofit. You decided to start as a B Corp. So are you a mission-driven company?
Yes, certainly we are. So that's actually interesting. I think part of that was informed by the reality on the ground for Aaron 10 years ago. He originally thought the idea of having a community resource platform there in Central Texas, that, yeah, this will be a nonprofit venture and we will fundraise and we will try to bring this to the community. At the time, I remember working in social services during any sort of dip in the economy, needs skyrockets, and belts are tightened. So individual donations, corporate donations, government grants oftentimes are hard to come by. And so at the time, he was actually challenged by kind of a mentor of his that says, throwing your hat in the ring as a nonprofit here in the Austin area at a time when so many nonprofits are struggling, you're trying to connect and bring people to these great resources. Maybe you shouldn't be competing with them for limited funds. So the idea of how they could be sort of a sustaining, social driven initiative came up with the idea to make us a B Corp. So we're a certified B Corp, and we actually, our mission to connect all people in need to the programs that serve them with dignity and ease really does inform everything that we do. It's part of the reason why we have our free findhelp.org nationwide site making it accessible for anyone to find and connect to these programs. To actually keep the lights on, so to speak, we partner with larger organizations in the healthcare space, education, community colleges, government, to create customized versions of our social care network. So think about it as different sort of windows into the same platform house, and they can customize and have, slight changes in how their community stakeholders access this information or presented with programs. So it's really helping meet people where they're at in community, but we always want to keep and drive awareness to findhelp.org as a place where anyone across the country can go to get the help that they need.
So that means you have great relationship with for-profit as well. So you only list nonprofit programs and services, or do you list for-profit services as well available for the community?
Great question. Yes. So while most programs on the site might be what you traditionally think of as governmental or nonprofit social service programs, we really try to widen the net of programs we're featuring, as long as it can help someone and be free or reduced cost. So the criteria to be listed on Aunt Bertha's platform is you must provide either a free or reduced cost direct service program. You don't have to work for a 501c3 nonprofit, though many of the resources we list are nonprofits. But you also can work for sort of, church, faith-based organization, even, a for-profit company that has kind of a corporate social responsibility arm. If you offer a sliding scale or meet people where they're at based on income for certain programs, you can be listed. So wanting to, again, really have that wide net so that if there are resources out there useful, people can find many different programs in their area, not just relegated to nonprofits. So nonprofits are the bulk of the resources listed.
That's great. Then you amplify a lot the possibilities. I heard also your company is based in Texas and you're here in Colorado. Is your company local for specific areas or nationwide?
Great question. Yes, a lot of people maybe only connect with Aunt Bertha in their community and are not aware that it's actually a nationwide platform. So we are based in Austin, Texas. That's where we started indexing services and bringing this information to the community down there. As we've grown over the last 10 years, we expanded our coverage to anywhere in the US and the US territories. So really wanting to make sure that anyone can find resources, whether they're located in a large metropolitan area or maybe more small rural communities. And so in terms of actually building awareness and engaging communities to interact with the platform, Aunt Bertha's invested in community engagement managers like myself across the country to help educate and support stakeholders, whether that be people seeking services themselves. Most of the way we do this is by training and supporting those community-based organizations on how to use the platform to coordinate services for their clients, as well as how to make sure that their free and reduced cost programs are listed. They can actually claim their listings. It's completely free and takes 2 minutes, giving them direct access to update any information and inform the best way for individuals to reach out to that given program. We want to remove the gatekeeper and really give them direct access to speak to all the users of the platform as things change, especially with COVID. So we actually really want to make sure there's someone on the ground like myself who has a background in community building, working with the nonprofit community, to help facilitate those connections and grow and strengthen our platform.
That's great. And your platform is free for nonprofit and end users, as I understand. But how do you keep your light on?
It's a good question. Yes. So obviously our mission is to let people have access to this information, to make it easy to search, find, and connect to community resources wherever they are across the country. So it is free for anyone to use the site, to self-navigate for resources. That's really an important point for us, to provide a way for individuals anonymously at 3 a.m. to look up and just say, hey, what is out there to meet maybe my food insecurity need or my behavioral health sort of challenges, anything that they're looking for. We want that to be completely open and free. At the same time, it is free for organizations to take advantage of our platform and all the free tools we provide to list and claim and manage their programs. We really want to make sure that this is easily available. In terms of a business model, we do work with larger organizations. So whether they're large sort of health centers, we work with UC Health, Children's Hospital here in Colorado, or whether it is local government like Jefferson County, we have a variety of customers that we create customized versions of our site for. So they have their own branded portal into the Aunt Bertha network. They're able to customize the experience of maybe which program categories they feature based on who they're serving. And then they actually are able to get reporting and a lot of metrics on how are people in their community utilizing that site. It's actually really interesting and important. It's a built-in community needs assessment. What are our community members and neighbors telling us are the largest challenges for them over time? What does that look like different from maybe this zip code to that zip code? Or rural areas versus urban areas. And that can help inform how they're looking to solve these sort of social needs and social determinant of health problems over time. They can say, where are the needs at in the community based on the search terms and the search results? Where are the resources currently mapped based on all the program information? And then where are those gaps? How can we use this data to inform and bolster our efforts to actually meet people where they're at and get their needs met on the ground?
Wow. And I bet there are other services similar, not that good as yours, but similar. Do you have any partnership with other platforms, other social companies like you?
That's a really a good point, Bettina. That's I think the crux of the area of how can we make sure that individuals who are looking for services have an experience where no matter where they're looking, they can find access to these programs. Definitely Aunt Bertha and findhelp.org is a great resource. There are a lot of other resource platforms and directories in community. And so, especially during COVID, everyone was trying to scramble to sort of index programs and figure out what resources are available, how they're changing over time. And we at Aunt Bertha really are committed to finding solutions for platforms and directories to interoperate, to work together instead of everyone listing a laundry list of community resources on their website that often nonprofits or community stakeholders have to keep updated. Is there a way that we can actually work smarter together to be able to feed in to one sort of source of record? So actually what we do is we partner with some other platforms across the country. We've established several partnerships with local 211s, sometimes powered by United Way 211s. And they have a call center where folks can call 211 across the country and talk to someone in need. That's a great option that Aunt Bertha doesn't provide. We're solely web-based, and our platform, we don't offer those sort of call centers. So we think bringing the benefit of our technology, our user experience navigating on the website with their deep community roots and their call centers is really a win-win. So we've partnered, whether it's data sharing agreements, whether it's exploring how we can work together to serve our shared purpose. And it's been really exciting in other places across the country what we've been able to do.
Alex, I've been working with Salesforce for such a long time, and Salesforce is an amazing platform to help nonprofits, such others available for this third sector. Is it possible to integrate Salesforce or other platforms with yours?
Yes, we obviously know there are other systems of record that nonprofits and other organizations are tracking engagements with clients, members, and customers. And we definitely want to make sure they have a way to interoperate or integrate with the Aunt Bertha platform. So whether it is Salesforce or for some of our medical partners, electronic health records, the ability to have access natively in their other applications to the Aunt Bertha network and tie that information together is really important. So we do have, we are finishing an integration setup with Salesforce, really excited about that. Currently, those full sort of platform integrations like Salesforce are for our paid customers. But what we're actually looking to do is find a way to make sure we're meeting nonprofits where they are and getting access to clients and customers through the Aunt Bertha platform, even if they use another system of record. So for example, I used to work for a daytime drop-in center for homeless women and children in Denver called The Gathering Place. And they used the Social Solutions, which is sort of a case management platform called Efforts to Outcome. Another one is Apricot. These are terms that might be familiar to some of your nonprofit listeners. And the idea is they currently, organizations can log into Aunt Bertha, see their referrals, respond to them, manage how people are connecting through the platform. But going forward, we want to be able to bring in sort of a patch through so that if someone makes a referral for Aunt Bertha for themselves or someone else, that can actually go into their other system of record. And those will be things that we'll be setting up to make it easier to meet in organizations where they're at.
And what are the most common integrations you have seen with your platform?
So really right now it's a variety of, Salesforce is definitely one we prioritize because as you mentioned, there's a lot of people that are using it. It's challenging because there are so many systems of record and vendors and databases out there. We would love to hear from nonprofits, and it's a question I often ask to kind of see here in Colorado, are there certain programs and platforms that are more commonly used that we can prioritize some of this integration work with through partnerships. So I had mentioned that Social Solutions, there's other case management systems, but Salesforce is one we're really excited about just because we know so many nonprofits use that service.
Can you tell us how do you include the programs available on your platform?
Yes, that's something that we really took a lot of time to set up. How are we making sure, especially at such volume across the country, that we're really indexing a wide variety of resources, ones that are vetted and actually offering those free or reduced cost programs. From the beginning, Aunt Bertha invested in a robust data team of real live humans that are tasked with vetting, adding and updating twice a year all the program information on the site. So currently we have actually over 60 data members, and they are working to ensure that those programs are meeting our mission, are really free or reduced costs, and over time able to track updates. So they update them twice a year. We know that, especially during COVID, every 6 months, is not, things change more often. So we've also been intentional of building in sort of feedback loops to help the community crowdsource information and inform us of what's going on. So we have the ability for anyone using the site to suggest a change to a program, whether hours are out of date or they've moved across the street, or a program is currently on a wait list or temporarily closed due to COVID. We ask that users help us and capture that information. And that goes back to that large data team to prioritize and update the information on the site. At the same time, I mentioned the ability to be able to claim your program listings on the site as an organization, to have direct access to inform the community by making changes to either the status of your program, hours, and making sure that the information is up to date. Obviously, that is the most important thing for a resource directory, and it definitely takes a village. So we really are intentional about trying to let the community be able to inform the site and actually activate findhelp.org in their area to help us as we continue to do the hard work of indexing all these social care programs.
Yeah, so if you're a nonprofit, please claim your organization inside this platform and try to update as much as you can. It's crucial. And tell me, if a nonprofit, for example, does some referrals, is it possible to track the results of the referrals?
Yes. And so what I really was excited about with Aunt Bertha is trying to go beyond being a sort of yellow pages of social care programs where you might just have an organization or a program and point people to their general website or maybe just their 1-800 or admin phone number. We want to make sure that for every program we list, there's a clear call to action as a next step. What should someone seeking services do? And we want to make sure that that's customized to meet the needs of the individual programs. So the program gets to decide when they claim their listing how people reach out. And we provide free digital intake tools to help them facilitate that connection and to track impact and outcomes over time. And so some of those include electronic referrals, where someone can refer themselves or someone else to that organization through the platform. The organization receives an email and they can go in and track and update the status of that referral in their inbound referrals dashboard. Similarly, any of the parties can update the information to, so quote unquote, close the loop on that referral. So whether I'm the one who made the referral for someone or the person referred, we can all go in and say what happened to that referral over time, and everyone is on the same page. So that's really important so folks don't get sort of, lost or fall through the cracks.
So they can you be more specific? What type of reports do you provide for nonprofits so they can capture the impact and outcomes?
Yes, great question. So we knew that for organizations, and myself coming from a philanthropy background, so much of what they do and getting funding depends on being able to prove impact and outcomes. Are they actually moving the needle in the service to the community? So the idea of how you're serving your clients, what is happening to individuals coming into your programs, it really takes a variety of different ways that organizations are tracking that currently. Some organizations, if they're large enough, might have a learning and evaluations manager where they're actually doing a reporting on the outcomes. Others are just tracking it in a Excel spreadsheet. So there's a variety of things. And we wanted to make it easy to build in sort of automated reporting, especially on the activity coming through Aunt Bertha, so that when organizations set up inbound referrals through the platform, it's capturing and crunching the numbers on that. So they have a variety of reporting on those they've served, the outcomes of the referrals, how many people are engaging with their program or service, where they're coming from. So you actually can see a heat map of all the people who found and connected to your program, what zip code or area of your region they're coming from. And coming up, we're actually introducing some additional reporting around search data. So we're giving organizations direct access to what is it that people in their coverage area are looking for on the platform. And that can help inform their funders, their board members of how they are currently meeting those needs and opportunities to continue to meet those needs. So there's pretty robust reporting that comes along with claiming your listing, which is completely free. And I'm happy to share more about that with interested organizations.
Thank you so much, Alex. I think all the nonprofits now are very excited by joining your platform and learning more. Talking about learning more, can you explain us what type of training do you have available for any nonprofit that wants to go deep?
Yeah, I definitely am excited to connect with any organization to share more. That's really my role, is to educate and support them so they can take advantage of this tool as another tool in their toolkit. I do offer monthly webinars. So we have an Intro to Aunt Bertha where we really go over how to use the site to navigate for resources, because nonprofits, they want to make sure that they're listed and that their individuals are connecting and finding their program. At the same time, all organizations, they never do everything under one roof. They're always trying to find and connect to additional community resources and partners. So they really appreciate the platform to be able to navigate. So I offer that as kind of an overview of the platform. And then we have, if that's a 101, say 201 deeper dive for those community-based organizations offering free or reduced cost programs, to go in how they can actually engage with the network by claiming their listing and adopting any of our intake tools, and then over time managing their programs through the platform. At the same time, I'm always available to meet with organizations and their staff to do individualized sort of training and onboarding, looking at what they're currently doing and in which tools, features, and functionalities are really maybe a good fit for helping them take advantage of the platform. So it's really about understanding the organization, their needs, how they operate, and see where we can be helpful.
That's awesome. So if you're really interested in making community resource navigation easier and more efficient, please go to their website. Can you tell the website, Alex?
Yes. So for individuals interested in learning more about Aunt Bertha, they can check out company.auntbertha.com. But we also want to make sure that people are sharing and remembering findhelp.org, which is our free community resource platform to actually connect to these programs.
So you as a nonprofit, it's very important to claim your org, access your account, edit any information you need, and please enroll yourself in any training available to learn more and see how can you be more efficient and people can know better your service. Alex, thank you so much. I really appreciate. I love to share information with nonprofits. My role here is really to be the trusted advisor for nonprofits, and you did an amazing job today helping them. Thank you so much, Alex.
Thank you so much, Bettina. I appreciated the opportunity to be on.
Thank you for listening to Wisdom for Nonprofits. To hear past and future episodes, please subscribe to the show on your favorite podcast channel. We appreciate your reviews and suggestions for future show topics. If you have a question or a suggestion, please write to us at podcast@wity.tech. More resources are available for you at our website, wity.tech. And please join us in the Wisdom for Nonprofits group on LinkedIn. Wisdom for Nonprofits is copyright 2019 by Bettina Meyer-Flug and wity.tech. All rights reserved.